Hi, thank you for choosing this lecture today. Simple Skin Cytology, you can do this. My name is Kelly Rogers and I've been a nurse now for 23 years. I ran a laboratory in a small animal hospital within Bristol for many years before switching to a locuming role. I've locumed at Langford for quite some time, a few years. And I've recently switched to a role within dermatology where I do a lot of cytology, I do a lot of microscopy work. And I'm here today to talk to you a little bit about my role, what I do, and also what skill set I have that we can implement as nurses within first opinion and referral to be able to provide our vets with a very good understanding of what could be potentially living on that skin and things. So, what is dermatology and why is it important? Dermatology is a branch of medicine that focuses on skin, fur, nails and ears. Ears. You'd be surprised the amount of clients we have come in, they're very confused as to why they've been referred to dermatology, whereas that does fall within our remit. I'd say 30 to 40% of the cases we see here at the hospital are chronic recurrent ear infections that they've tried everything and things like that. So ears do fall within our remit as a dermatology team. So why is it important to understand dermatology? Simply put, all animals have skin, they have furs, they have ears. So when an animal presents to the practice that has itchy skin or an active ear infection, the vet will initially see it and they may already think, okay, well, I have this treatment plan in place. Whereas as nurses, if we can do an invaluable job of gaining extra information that may alter the way that that animal receives its treatment, just by gaining a small amount of tissue, either from the skin or a little bit of earwax, staining it up and look at it under the microscope, we can actually provide our vets with an invaluable amount of information that may ultimately affect the way that that animal is treated. What is cytology? Now, rough overview of cytology. It's simply put, the study of cells. And this plays an invaluable role within the work we do here at Langford. Most of them that come in will have a cytology done of wherever the presenting issue is. So by doing this, we can determine the presence or the overgrowth of certain types of cells, certain types of organisms, are causing a lot of different dermatological problems such as alopecia, crusting, open sores, active infections, itchiness, redness of the skin, things like that. And I am a real firm believer that this is something that we can all do as nurses. This is something that I feel that we should be able to provide for our patients. And there's a real myth around cytology that it's very technical, it's very hard. It's really not. As soon as you can gain a confidence in what you're seeing and how much of it you're seeing, whatever it is you're seeing, you will fly. You won't have a problem doing this. And if you can provide yourself with a skill set that is invaluable within practice, we really should be doing this as nurses. But I really do believe that this is something that as nurses we can all do. And I'm really hoping that by continuing to watch this video with me today, that I'm able to boost your confidence to at least go away and think, actually, that's something that maybe I could give a go and I could do, and maybe it's something I should pursue. So let's continue. I'm going to talk to you now a little bit about sample collection. And as long as this is non-invasive, we are able as nurses to do this. So this is something that we can all do as nurses. this can be done in the form of impression smears, sellotape strips, cotton buds for ears, things like that. And I've got some slides here to go through with you with regards to collecting samples and things. So equipment required. This here is a picture of some of the equipment that you will need. So the only thing I couldn't get on this image, which is really, really important to highlight, is gloves. We will need gloves for skin. You'd be amazed at the amount of these that we see that are infectious. So I would always recommend that you've got your gloves on. So we've also got our slides, cover slips, some artery forceps. We use sterile ones here in the hospital, just to prevent any patient cross-contamination. We've got sellotape. We tend to use Scotch tape here in the hospital. It's just a very good make of sellotape. And we do use this dispenser just to prevent, trying to rip it with our teeth and stuff like that, because that's just gross. And we've also got some cotton buds and the all important pencil. Pencil doesn't get washed off by Diff Quick, so it's really the best to be using to label up slides and things like that. But it really is imperative that we do label slides, especially if you've got multiple sites or you've got 2 bad ears. If you find 2 different things living in each of those ears, and you haven't labelled them, it's going to be very tricky to explain to that owner to come back in and repeat those cytologies because you didn't you didn't write on the slide. Okay, so hopefully you're all familiar with this image. This is a picture of Diff Quick. So most practices use this. Everywhere I've worked, they've had Diff Quick. Now, ideally, you should have a separate set for your skin cytology. If you're doing a lot of hematologies and FNAs in-house, ideally you should have a separate set for your skin cytology, purely because there's usually lots of bacteria and we want to prevent cross-contamination. Although I do appreciate that this is a pricey way of doing things, and it might not be something that your practice is financially viable to do. So ideally, in an ideal world, your Diff Quick should be changed weekly, and that's if it's clean. So if you're seeing a lot of MRSP or Pseudomonas cases, so I'll go into that a little bit further on. In these cases, really, if you're seeing this on slide, you really should then, in an ideal world, gold standard would be that you throw away that Diff Quick, you thoroughly clean the pots, and then you replenish your stock again. It's not always financially viable to do that. It's not always cost effective in your smaller practices. So we all know how this goes, but I'll run through it anyway. We've got the 3 pots there. We do 5 dips in each pot. Now they don't need to be, I see it all the time with students, they just do a quick 1, 2. It doesn't need to be like that at all. You can really get the slide in there, give it a little waggle, wait a few seconds and pull it out, and then repeat. The longer that your sample has in contact with your stain, the more it's going to pick up, and then the more information you're going to be able to garner should there be anything on your slide. The only time I won't use the fixative is if I've got a sellotape strip, and the reason for that is that the glue reacts, the glue on the sellotape strip does react with the alcohol within the fixative. It causes it to go very, very cloudy, and then that slide then becomes very difficult to interpret. So I would do stain 1 and stain 2 for sure, but I would never, on a sellotape strip, I would never use the fixative. Simply because it's just going to obscure our view and we're not going to be able to get a full picture. And that's the end of this section. I really hope that you will join me in the second part of this video, just so that I'm able to go through some sample collection with you and how to interpret those results. Thank you.